getting abused, but our laws must also emphasize the provision of opioids such that they are made available for medical research purposes. So with that discussion with state authorities for over 2 years, we have been able to get morphine to Sarah.
How many patients have you got in your care, and are they spread over a very wide area?
Yeah, well, yeah, it's in Freetown. We have our concentration more is in Freetown.
In the city?
In the city, yeah. We have vehicle, we have XL bikes and social workers and community health officers can visit these patients at home.
And are they all working for this organisation?
Oh yes.
So how does the funding work?
Well, the funding for palliative care is provided by a group. We have a community, a registered community service in UK called UK Friends for Shepherd Hospice.
With Sheila
Houghton.
From Princess Alice.
From Princess Alice.
Yeah,
so she raises funds from private people, and that is sent to us to buy drugs, to pay transport for patients, to pay staff, and buy fuel.
Is there any government funding at all?
Or no government funding?
It's purely a charity.
Do you have inpatients, patients actually in the hospital?
No, we don't have patients that.
It's all in the community. It's all
Yeah,
out
they
in the
live in the
community.
communities, except we have 2 beds. This is like providing some observation for a patient for a whole day, and in the evening we see how we can take it back.
So how many people are you caring for in the community at any one time?
Yeah, about 78 patients.
Oh, 78?
Yes, 78.
I thought it was maybe more than that.
And you have a chaplain or social worker, or someone with psychological
we
care?
have a chaplain.
And is that someone who
There
works?
is a social worker.
And does he or she work full-time for the organisation? So helping the patients to come to terms with their diagnosis and...
Wow, well, we have a culture of death denial. Please don't tell him, don't tell her. So, wow. I think for our patients, we have really come to realize that telling them the truth helps them greatly.
But do the families allow you to tell them?
Well, sometimes in confidential nature, because you are alone with the patient, and you tell the patient, and the patient says, please don't tell my partner, don't tell my wife, don't tell my husband. You know, but sometimes the partner is also worried, is also apprehensive, and the partner wants to know why. But the moment they know, then you see coping improvement.
Yeah. And they can then talk to each other.
They talk to each other, and the relationship becomes very helpful.
Is that complicated by the prejudice against HIV and AIDS?
It is.
And that must be your biggest
challenge.
condition.
And except now with antiretroviral therapy, I think.
Is that available in this country?
Yes, we have antiretroviral therapy free.
Free?
Yeah, it's provided through the public health services.
So do they channel that through you, or do your patients have to go to that?
Yes, that is the reason why we need transport fare for our patients. We have to refer our patients to the public health service.
So your doctor's not allowed to prescribe that?
Well, no, he's really allowed to prescribe that, but it's really the prerogative of, I think that is one That is, it's the the National AIDS Secretariat makes decision as to which services to have the treatment and which services to have the drugs. For us, because we really want to emphasize cancer now, we don't want to take on board a lot of HIV disease. Doing VCT, voluntary counseling and testing, all those things, and as the only palliative care or hospice in the country, and we take on board much of HIV, then you will not have much time for cancer. Pardon? Yeah. So, because you have a lot of support services,
Yes.
so we may want to give off some work in the area of HIV so that we can really establish our cancer care, our palliative care for cancer patients more.
Which is a specialist
That's
division on that, that's good to focus on that.
Don't you think that you will be this? You will be what do you call it? Discriminating the HIV patients because they also have a terminal illness.
Yeah.
So why would you not?
Yeah, well, it is a question of having small resources. Say, let me carry a portion of responsibility. Otherwise, HIV, because you have, you know, the nature of our population in Sierra Leone, you have more HIV as a chronic condition, and because about I can say about 51% of our population are very young people. So people who live longer to develop cancer is always very small. So if you are a specialist care and you want to be so diversified and broad, my worry is staff get burnt out. So what we are doing is working with, we have a training program which is supported by a capacity building program supported by Bread for the World, JAM. We do a lot of training for health service providers like community health services, Connaught Hospital, and we train them on palliative care skills. And we also allow them come here for some training. That allows them to be able to provide palliative care alongside their normal services. So it helps us concentrate on a very small portion of patients who are really terminal cases, and then avoid workers getting burnt out without creating any sense of discrimination. It's really a question of, say, you specialize somewhere. That notwithstanding.